I'm a psychotherapist and a personal trainer, and today I'm going to be talking to you about chronic pain, which is a condition of the mind and the body, which is why I think I've been asked to talk about it. But to begin with, let's consider acute pain. Acute pain, an example would be when you put your hand underneath a hot tap. It hurts, so you yank it back. What's gone on inside the body and the brain there is that sense organs in your hand have sent a message up to the brain about the hot water. The brain's realised it's potentially damaging, so it sends a sensor in the brain sends a signal down to the hand to make it hurt so that you yank it back. Pain there is a messenger. It's being used to protect the body from potential damage to its tissues. The brain knows exactly which bit of the body is under threat because it has a map of the body inside it, and there are pain receptors, pain sensors corresponding to every different part of the body. That's acute pain. Chronic pain is pain that lasts for 3 months, 12 weeks or longer. Often long after the original tissue damage or disease which caused it in the first place has healed up. That can happen because some of the pain signaling receptors in the brain get stuck in the on position, equally or due to some kind of nervous system damage, creating what's called neuropathic pain. But pain can also be affected by our emotions. Anxiety, depression, and trauma in particular will make chronic pain worse. This is because the parts of the brain that are responsible for processing those emotions are also the parts of the brain that are responsible for processing chronic pain, particularly the hippocampus, amygdala, insula, and the posterior parietal lobe. If you're anxious or depressed or traumatized, those parts of the brain responsible will be sending out signals to the body about your distress, and that will be felt both emotionally and physically as pain. Anxiety and depression in particular also reduce the level of serotonin in the bloodstream, which is a natural painkiller, which again makes the whole issue that much worse. But this does give us the opportunity to use psychotherapeutic techniques to reduce the pain, but which we need to do because we need to reduce it and also stop it spreading, because what can happen inside the brain is that the pain signaling sensors in the brain will start to send out signals to other adjacent parts of the brain, which obviously correspond to adjacent parts of the body, and this is how chronic pain can spread. So, for instance, from the lower back down into the gluteals, down into the leg, through the effect of neuroplasticity. But fortunately, we can use psychotherapy to combat all of this, either by reducing the impact of pain itself. If we could process the underlying disturbances which are causing the anxiety, the depression, and the trauma in the first place, that will calm down those different parts of the brain and stop the signaling of distress. Meditation and mindfulness in particular work on the insula, which is the part of the brain, the key part of the brain that's responsible for the processing of pain and emotion. It can calm it, can relieve distress there, and again stop the signaling of pain. Visualization has an incredibly powerful impact on the posterior parietal lobe, because that part of the brain is responsible for both visual information and pain, but it can't process both at the same time. So if you can flood your posterior parietal lobe with visual information connected to, for instance, a pain relieving visualization or relaxation exercise, that will switch off the pain sensors in that particular part of the brain. EMDR, eye movement desensitization and reprocessing, works at the level of the non-verbal brain and also the nervous system to introduce the idea of adaptive information. You might have a part of the brain, for instance, which hasn't realised that the original tissue damage has healed up, and so it continues to send out pain signals. EMDR can connect that part of the brain with another part of the brain that has realised that the body is now well and healed, and then the person is able to move around freely without too much pain, without any pain in fact, and hence the pain signalling in that particular area can be switched off. But it's also EMDR is a very powerful method for resolving the underlying trauma which may have been causing the pain in the first place. So seeking out an EMDR therapist who specialises in those areas can be extremely helpful. It's also incredibly important to recognise that the pain, as I said, is of the body as well as of the brain, chronic pain. So what we're doing with our bodies, the more we can move, the fitter we can keep our bodies, the in better shape we get. That also helps reduce pain, particularly in the area of lower back pain. By undertaking an appropriate exercise program with, say, a personal trainer who's trained in work with the lower back, or as directed by an osteopath or a physiotherapist, really can help by increasing the strength, your all-round fitness, but also your core strength, so that you're adapting to your posture, so helping you stand up correctly, walk correctly, lift correctly. All of these things can really help reduce pain and prevent further injury and further occurrences of chronic pain. NICE, the National Institute for Clinical Excellence, for instance, actually recommends both an appropriate exercise program and psychotherapy for the reduction of chronic pain, especially where someone who's had chronic pain, chronic lower back pain for a very long time, and maybe has tried other more traditional approaches and they haven't worked. They would recommend both working with a PT and with a psychotherapist to help relieve the pain. So if you're suffering from chronic pain at the moment, I wish you good luck. There's a lot that can be done, both psychotherapeutically and also through exercise and movement. So by talking about your problems and also moving more, exercising more, and building up your strength and fitness. So I wish you luck. I hope you're able to find the sort of help that you're looking for. Thank you very much. Goodbye.